Hello everyone, welcome back to my channel. I am Dr. Dhanya. Today we are diving into a topic that every IMGs have in their mind while preparing for AMC exams. What happens after AMC part 1? Today's session I will break it down into 3 parts. First part I will discuss about the job positions available for IMC. Second, how to apply for those jobs. Third, the current situation of getting a job after AMC part 1. And finally, some points about the PESCI pathway also. So let's get started. So in Australia, after completing the medical school, you will become an intern or postgraduate year 1 level or PGY1 level. That is equivalent to the house job, house agency internship in your home country. So if you have completed the internship and passed AMC part 1, then you can apply for jobs to the next level, that is PGY2 level, postgraduate year 2 level, that is the resident job. So in different state they are named as different, and they include the resident medical officer RMO, the junior medical officer JMO, the junior house officer JHO, and hospital medical officer 1 HMO 1 in Victoria. And if you have further experience in your home country, then you can apply for PGY3 level jobs. They are senior resident post. In a junior resident post, you have some supervision and more responsibilities are there for the senior resident, similar to your home countries. And in that position, they include PGY3 level include the senior resident medical officer SRMO, senior house officer SHO, and hospital medical officer 2 HMO 2 in Victoria. And if you have more experience than a PGY3 level, then you can apply for PGY4 level jobs like a registrar level jobs. But actually they are the unaccredited registrars. That means they are similar to the registrar in their responsibilities, but they are actually not in a training program. So once you get a postgraduate position here, then you will become an accredited registrar, and completing the postgraduate training you will become a consultant. These are the job positions available here for IMGs. But most of the IMGs apply for a job at PGY2 level. This is to get a supervised practice, and that will be easier for you to get adapt to Australian healthcare system, and the chances of getting jobs are also more in that level. So that is the thing regarding the job positions. Another important thing is getting a job is totally depending on the CV, the interview performance, and the overall performance of a candidate. Even after getting a job, the promotion to the next level is totally depending upon the performance of each candidate. So that is the important thing you have to remember while applying a job. So now we can move on to the application process, or how to apply for this job position. So there are different ways to apply for jobs in Australia. The first and most important one is through the state government health website. Each state in Australia has its own health website, and the hospitals in those states will list their vacancies in that website, and you can search for those jobs and can apply for those jobs. And there are RMO campaigns that happen every year, once or twice in each state. They are also through these websites itself, and the campaigns means there is a bulk of vacancies. They will appear at the time of campaigns, And after completing the campaign, the first campaign, if there is any remaining vacancies, they will appear in the end of the year, like in the October, November months of the year. And usually the first campaign is happening around the May, June, July months. So all these are appear in these state health websites. I will share the link in the description box for you. You can search for the corresponding websites for your jobs. Then the next way is to apply for jobs directly through the hospital website. It's the website for Queensland Health, in which you have to go for the medical career and search a keyword, RMO campaign or RMO jobs. All these are last year campaign details, and this year campaign dates are not released yet. So last year campaign is for the clinical job positions in 2025. So this year campaign is for the clinical positions in 2026. That thing you have to keep it in mind. This is the New South Wales website in which you can go for medical jobs. Here you can see junior medical officer roles. Here is last year dates, campaign dates. This year campaign dates are not yet released. So for the junior medical officer campaign for 2025 clinical year is now closed. If you are interested in JMO role in New South Wales Health in 2026, more roles will be advertised from May 2025. So you have to check this website after May 2025, from May 2025. So this is the Victorian Health website. Here you can see the tab for hospitals, and here the public hospitals in Victoria you have to select. Where you can see a list of hospitals and go for their website and search for their career tab and look for any vacancies are there. So this is the website for South Australia. Here you can search for the keywords, RMO campaigns. I think the dates are not released yet. So this is a website for Northern Territory, and here you can search for the keyword RMO campaign, RMO jobs, JMO jobs, etc. And if any vacancies is here, you can apply for that jobs. Now this is a website for Smart Jobs Queensland, and here you can search for the medical officer keyword, and if there is any vacancies in hospitals you can see here. So this is for Tasmania Health, and here you go for medical career, and here you can search for medical officer or RMO, and if any medical jobs are there, they will appear here. Okay, these are in nutshell about the websites for the job applications. CV is the most important thing in your application, and you have to update your CV for each job position and highlight the relevant clinical skills or experiences if you have them in that CV that matches the specific clinical role that you are applying for. And you have to be thorough with the Australian guidelines before your interview. So these are the most important two things I want to share. Is it difficult to get a job after AMC Part 1? This is the biggest concern most of the IMGs having right now. To be honest, I will say yes, it is becoming harder, but it is not impossible. The reason behind this is the applications are increasing every year, and the number of candidates appearing MCQ exam is also increasing every year. In 2023, about 4,400 candidates appeared the exam, and in 24 it become 6,300, in which 51% passed the exam, but the AMC Part 2 clearing rate is only 24%. So most of the candidates try to get a job after AMC Part 1. So that is the scenario, and every year the applications are increasing and the applicants with additional qualifications also increasing. There is shortage of doctors in Australia, that is true, but those shortage is mainly in rural areas or remote areas, and most of the IMGs want their jobs in urban areas, so that is also another reason for not getting a job. If you are open to work in rural areas, the chances are higher. So that is another thing. In some states like New South Wales, Queensland, etc., there are more opportunities. So I want to tell one thing. While applying for these jobs, you have to prepare for AMC Part 2 without wasting time, because the number of candidates clearing the AMC Part 2 is also increasing. And that is about the current scenario. Now we can move on to the PESCI pathway. So before I wind up this session, I want to share some points about the PESCI pathway also. So what is PESCI means? The pre-employment structured clinical interview. This is an opportunity for an IMG to get into general practice after the AMC Part 1 exam. So once you clear the AMC Part 1, and if you have a job offer letter from a general practice sector, then you can apply for this interview, and this is conducted by RACGP and ACRRM. RACGP, Royal Australian College of General Practitioners, and ACRRM is the Australian College of Rural and Remote Medicine. And one more website is there, and the main two are these two, and there is a fee like $450 for this interview. And after applying, and if you complete or clear this interview, then you can apply for this limited registration to practice in that sector. And while practicing, you can apply for the AMC Part 2 also. So that is in nutshell about the PESCI pathway. If you want more details about the PESCI pathway, or specifically a session on PESCI pathway, I will try to make. So that is about the PESCI pathway. I hope you like this session and you find this session helpful one. And if you have any queries or suggestions, please feel free to add it in the comment section. And thank you for watching.